Good morning, everyone. Dr. Brandon Bupp back with you at Advanced Health Wellness Center. This is our Monday morning kind of educational, informational piece. Guys, it's so important to be knowledgeable about your health. Knowledge is power, and knowledge absolutely can have a significant effect on your health. And you should be the right information as well. So look, I want to talk about headaches. It's not just a headache, guys and girls and anybody listening. Here's the deal. Your nervous system sits right below. Here's the skull. Here's your spinal cord, spinal nerves. Y'all know there's something called cranial nerves. And all of those things can be affected or have an effect when someone gets headaches. Guys, there's a reason why the headache is happening in the first place. It's not a prescription deficiency. It's not an aspirin deficiency. It's not an ibuprofen deficiency. You're not getting a headache because you don't have enough medicine in your system. There's a reason. And so it needs to be evaluated. And I want you to think about the structures that are involved when you have a headache. So number one, your spinal cord is right here, your spinal cord and your brainstem, and then the cranial nerves. So in order to have a headache, there has to be a problem happening here that's affecting them. Could a magnesium deficiency affect the meninges, or could a magnesium deficiency affect the suboccipital muscles and create tension and stress? Yes. But in order for the headache to actually be felt, your nervous system has to be involved. And the nerves that we're talking about are cranial nerves, the brainstem, spinal cord, and spinal nerves. All those things run your body. Your brain has to be able to communicate clearly with the parts in order for the body to function efficiently, or even the way that it should. The power center has to get power to the parts. So what that means is we have to evaluate and assess the mechanics of the upper cervical spine, whether there's stress, where there's stress, how there's stress, how it's affecting things. We do that through a nerve scan. We do that through thermography, measuring the temperature on one side compared to the other. You can actually measure the temperature behind the ear on each side. That gives us valuable information about how the nerves are being affected. We also look at EMG, so electromyogram, surface EMG, that tells us if there's stress and tension on one side or the other. And then of course an x-ray, so we can see what the spine looks like. But guys, it's not just a headache. There's a health impact to your headache. So I would encourage you to understand what's happening. There's all kinds of different things that can be done with it once you know why the headache is occurring. So we just encourage you to dig into it. Dig into it and don't just leave it as, well, it's a headache and that's it. We'd be happy to help if we can. Comment, share this with your friends and family. Guys, I can tell you that our success rate with headaches is 95% successful in these headaches either being reduced or gone. 95%. And then think about the effect that has on not needing medications that have detrimental effects to liver and kidney, stomach, with bleeding or kidney problems and dysfunction. Guys, it's significantly valuable to find out what the heck is going on. Hopefully that helps. Hopefully there's some information there that you can use. And hopefully we'll talk to you soon. Have a good day.